Today, I'm going to tell you a tragic story about a girl's body dissolving into a couch. Lacey Ellen Fletcher was born on November 25, 1985 in Louisiana, USA. From the age of 10, she and her father, Clay, and her mother, Sheila, moved to Slaughtertown, with over 900 people. She started a warm and peaceful town life. In people's eyes, she was a girl from a wealthy middle-class family. Very polite and educated, she attended a local church school. In the memories of the peers, Lacey was a warm and kind person who loved sports. She was a key member of the school's volleyball team. For many newly transferred students, the first friend they made was Lacey, who came forward to help them adapt to the new environment. In general, a girl with a good family background and a good character like Lacey, even if her future life is not brilliant, it will definitely not be too bad. But from the age of 13, classmates began to notice changes in her. When girls of the same age began to show interest in topics of adolescence, such as the opposite sex and emotions, Lacey's interests remained the same as in childhood. Perhaps noticing that she had less and less to chat freely with her friends, Lacey gradually became silent, even anxious about communication with people. Then some time passed. Lacey just disappeared from school. At that time, she had only finished 8th grade. Later, her parents Clay and Sheila told the school and their friends and family around that a doctor diagnosed their daughter with autism, a condition called Asperger's syndrome, and she was struggling to adapt to school life. So from then on, they would take care of her at home and educate her themselves. That's how Lacey's appearances in public and being seen by others started to lessen. Eventually, her life mostly became staying at home, except for the occasional visit to the psychologist. According to the medical records available, the last time Lacey went to see a doctor was in 2001 when she was 16. As for her mental and physical state at that time, from the currently disclosed information, we can't know. Anyhow, since then, Lacey never visited a doctor again and rarely stepped out of her home. One day in June 2006, a woman living nearby, while on her way home, saw a very thin woman walking slowly on the road, lifting a small dumbbell in her hand. Seems to be doing some physical rehabilitation exercises, because I haven't seen this woman around here before. She took a few more curious glances. Then she was shocked to recognize the woman doing the rehabilitation exercises was actually Lacey, who used to attend the church school with her son. At this time, she should already be 21 years old, but her thin figure and the pale complexion caused by lack of sunlight made her look like a teenager. And this was also the last time Lacey was seen. Afterward, she seemed to completely disappear from the world. Memories about Lacey also gradually faded from the residents' minds. In 2017, a neighbor close to the Fletcher family, while chatting with the lady of the house, Sheila, suddenly asked, "I remember you should have a daughter named Lacey, right? Haven't seen her for over a decade. Has she gone to another city after getting married?" Unexpectedly, upon hearing this, Sheila immediately said, "My daughter hasn't gone anywhere. She still lives at home with us." Seeing the neighbor's astonished face after, Sheila quickly changed the subject. Then, this neighbor thought that every household has its difficulties, and they didn't think much of it. Another 5 years passed by. A huge news was about to shake the whole town, even the entire United States. On January 3, 2022, Lacey's mom, Sheila, dialed 911, saying her 36-year-old daughter had suddenly passed away at home due to illness. When the paramedics arrived at the scene, their first impression was, judging from the state of the house and the well-maintained lawn, it was a middle-class home in good condition. They thought the house must be neat and tidy too. Then they saw the homeowners, Clay and Sheila, standing at the door to welcome them. Before they entered the scene, they usually need to ascertain with the couple what exactly happened in the house. According to them, they left home for a 2-day vacation on New Year's Day, January 1, 2022. They had just returned home today and found their daughter wasn't breathing. After listening to their story, emergency personnel immediately pushed the door in to check the situation. With any luck, maybe Lacey could still be revived? But the moment the front door opened, The emergency personnel realized that the situation was really bad. A smell mixed with feces, urine, and rotten meat hit them in the face. Even if they covered their noses and mouths immediately, that intense smell seemed to invade their bodies through their pores. It made people's hair stand on end, and stomach acid surged. If it were up to most people's instincts, they would definitely turn around and run at this point. But the emergency personnel, true to their professional spirit, still entered the room. Then they found Lacey, who had died long ago, in the downstairs living room, on a very old leather sofa. Actually, using the word on the sofa to describe the situation wasn't particularly accurate, because the paramedics could see that due to Lacey sitting on it for years on end, the middle of this old leather sofa had sagged significantly, forming a large hole, the leather on the sofa and the sponge underneath. It's all worn and incomplete due to years of wear and tear, and Lacey's thin and shriveled body just fell into this hollow. It seemed to melt into the couch. Of course, not just that, the top and surroundings of the couch, including Lacey's own body and hair. Even earwax was filled with her own feces and urine. When found, Lacey was just wearing a ragged t-shirt, almost naked, curled up in the indentation in the couch. She kept lying on her left side, both eyes wide open, her mouth also wide open, exposing the upper row of teeth. Seems to be trying to call for help with her last strength. Besides the feces and urine all over her, what moved the rescuers and the police who came later was that there is hardly any intact skin on Lacey's body. After an initial check, they found, probably because she had been sitting on this couch for a long time without moving, Lacey's whole body was covered with bed sores. And these bed sores, because no one took care of them, eventually burst and inflamed, becoming large ulcers and terrifying red patches. And the smell of rotting flesh and feces attracted all kinds of terrible insects. They bit Lacey and laid their eggs in her wounds, which left her body covered in insect bite marks and lumps. Maggots wriggled all over her body. On the right side of the sofa, there was a simple movable toilet. In front of the sofa was a black low table, cluttered with some lotion, a bit of baby powder, some air freshener, and a pack of wet wipes. These indicated that the Fletchers occasionally still do some simple treatment on their daughter's wounds. But even professional doctors might struggle with Lacey's terrible ulcers and bed sores. How could they possibly be cured with a little lotion and powder? Based on Lacey's condition, the coroner who rushed to the scene guessed that the poor girl's time of death should be between 24–48 hours. According to Mr. and Mrs. Fletcher, they left for vacation 2 days ago. So it's likely that Lacey was already dead, or in a dying state when they left. What kind of careless parents could ignore such a situation and still happily go on vacation? After being taken to a nearby hospital, Dr. Ewell Bickham, a professional coroner, immediately conducted a more comprehensive examination of Lacey's body. He found no food remnants in Lacey's stomach, only some sponge torn from the couch, and even feces from Lacey herself. This shows the painful struggle of the girl, in her last moments trying to survive. Realizing this, tears instantly poured from the eyes of the coroner, already accustomed to life and death. He concluded that Lacey's cause of death was chronic malnutrition and acute starvation, compounded by body-wide bed sores that had developed into deeper ulcers, which then affected the bones, leading to bone marrow infection. These combined factors triggered sepsis and ultimately took Lacey's life. Moreover, Dr. Bickham discovered Lacey's buttocks and thigh muscles had almost completely vanished, leaving only skin dyed the color of the sofa. This was likely due to muscle atrophy from sitting on the sofa for years. Based on these findings, Dr. Bickham determined that Lacey had painfully sat on that sofa for at least 12 years without moving. How much must parents ignore their sick child to do such a thing? Faced with this question by doctors and the police, the Fletchers stated their daughter Lacey suffered from a rare condition called locked-in syndrome and was almost paralyzed. She felt most comfortable staying on that sofa and usually urinated on a towel next to it. Thus, Lacey was very resistant to leaving the sofa. And according to medical records, the Fletchers had contacted a doctor in 2010, asking for help because their daughter was being stubborn and didn't want to leave the sofa. What should they do? At that time, the doctor advised them best to bring Lacey in for a checkup at the hospital, but the Fletchers didn't afterwards take Lacey to see the doctor. The hospital didn't follow up either. And so, the matter was left there. The Fletchers then added, over the years, their daughter has never complained, never said she felt pain from bed sores or ulcers. So they just followed their daughter's wishes. Let her stay on the couch. They didn't curtail her freedom either. If she felt endangered, she could go out and ask for help anytime. But the police found it hard to accept the Fletcher's statement, because the so-called locked-in syndrome refers to severe brain injury leading to complete paralysis, but with a clear consciousness. Patients can only control their eyelids and communicate with others by blinking, but Lacey's condition was clearly different. She still had some motor functions. She was even able to tear off a sponge to stave off hunger at her weakest. So she is very likely not a patient with locked-in syndrome. The reason she shows symptoms of partial paralysis is probably because her parents' long-term neglect and irresponsibility led to her malnutrition and muscle atrophy, complemented by full body lesions that ultimately took away her freedom of movement and even the ability to ask for help. Moreover, the forensic scientist determined that although Lacey might have difficulty expressing her feelings due to autism, she still retains normal sensory capabilities. She can still feel the extreme pain that happened to her. But facing her cold-blooded parents, she could only sit paralyzed on the sofa, soaking in her own excreta, enduring the pain day after day, until the end of her life. The forensic scientist tragically wrote homicide in the cause of death column for Lacey. And then on April 2, 2022, the Fletcher couple was arrested. The case then began to be known by more and more people through media reports. How do you view this incident? Thanks for watching. Don't forget to subscribe to my channel.